What's going on, folks? This is Joe Balance. I created the page Let's Talk Respiratory. I created the page because I feel like the field of respiratory isn't represented as much as I would like to see it represented. And current healthcare. A lot of times in healthcare, you'll hear about the nurses, you'll hear about the doctors, even radiology. But you don't hear as much about respiratory, and we're an integral part of the healthcare team because especially with the pandemic that's going on right now, a lot of respiratory ailments that we come across, we're the first line of interaction. Receiving patients into the emergency department, trying to figure out what discipline would be best for them, whether it's BiPAP, CPAP, something simpler like nasal cannula, maybe a non-rebreather, or something more invasive like non-invasive ventilation that comes after the patient is intubated. So I just decided to bring my thoughts on respiratory to the forefront, show some therapy, show some, things that we use in the hospital that aids in the rehabilitation of a certain patient in the population. So I created the page maybe about, a year ago, and I've been just putting different kind of therapies on there, like it's BiPAP all the way down to nasal cannula, all the way up to endotracheal tube, things that we use in respiratory on a repeated basis. And I received a lot of people saying, thank you for the information, thank you for the things that you put out, the videos you put out, because we're going through this in school, and I mean this is helping us in our clinical our clinical rotations, even respiratory therapy people that's in the field right now. I may be using the therapy that you don't use, or you may be using the therapy that I don't use, and we can cross, knowledge and, interactions and see how we can better bring, these informations to a larger scale of individuals. So that's what, Let's Talk Respiratory is all about. It's about bringing, respiratory to a grander scale of things, making it, more widely known, getting us the recognition that we really deserve, because we're a really integral part of the healthcare team. And we don't do this for recognition. We do it because, like I told you before, I was in patient care. I was in patient care for maybe about 7 years. I was a home health aide. I worked in patient care. I took care of patients. I gave them the medications. Made their dinner, took them on outings. So I knew at that point in time that I would be interested in respiratory. I knew at that point in time that this would be a career field that I could actually, put my feet in. And I haven't turned back. I truly enjoy it. I truly enjoy being a respiratory therapist. I truly enjoy working with the doctors and the radiology and nursing. All of us, putting our brains together and coming up with, the best form of therapy for the patient. How do we proceed after we give them the initial therapy? How do we go about trying to wean them off of certain therapies to get them, back on their way and back home to their families? And that's the main point of coming to the hospital. You come to the hospital, you have an ailment, you have a pathology or something that is ailing you at the moment, and you go there and you get the therapies and the medications and the things that you need. More so therapies, teaching the patient certain how to function if they're able to without coming into the hospital. But a lot of times it's necessary to come into the hospital, and it's us that's greeting you at the door or once you get into the hospital, and trying to make you feel as comfortable as possible. We want you to you're already in the panic. A lot of times patients come in with COPD, exacerbation. They're unable to breathe. They're unable to, fully deflate their lungs or let all the air out of their lungs. People come in as status asthmaticus, and, they just cannot breathe, and we, give you whatever kind of therapies we feel like you need in conjunction with the doctors and the other healthcare team. We give you the therapies that we feel as a conglomerate that will be both beneficial to you on your progression and rehabilitation on getting out of the hospital. So that's really why I created Let's Talk Respiratory, to bring education and awareness to the field of respiratory. Together, the healthcare team works so diligently together to get things underway, so the patient can get back home to their families. And it's really important. It's really important that, we give our best effort, come in courteous with a smile. Because a lot of times the patients come in and they're just, they're scared, maybe frantic. They may not know, if they'll ever return back to their family. So we just try to give them some, peace of mind and some aid to let them know that, we're going to do all we can do as a healthcare provider. I certainly would do all I can do as a healthcare provider. to give the best therapies and education possible so I can get you back home to your family, you know. I'm going to do it with honesty, you know, respect, courtesy, and everything that makes me, you know, a good respiratory therapist, you know, bringing compassion and empathy to, you know, the patient population and their rehabilitation. That's really what I got into respiratory, because I'm an empathetic person. Like, I just really feel passionate about patient care, and I think that may have been. I feel like that's part of my calling, is to be a patient care advocate, help with rehabilitation, and just make sure the patient are, you know, comfortable enough, you know, and making sure that we can do that I'm doing all I can do to, you know, contribute to the rehabilitation of the patient. So thank you for tuning in to Let's Talk Respiratory, and see you guys on the page.